Postpartum hair loss is a common concern for any woman, right? So, can it be prevented or minimized in any way?
It is possible to avoid it. First of all, it's a very beautiful thing, bringing life to earth. So when you're pregnant, when women are pregnant, they normally have good hair. If you notice, their hair is thick, it's shiny. All of a sudden, they've got the pregnancy glow and all of that. It's basically your female hormones all over the place. But after pregnancy, same like what I mentioned in case of COVID, where your telogen effluvium, your body goes into recovery mode. So that's when you start losing hair, you start losing the glow on your skin, and you start seeing pigmentation and all of that. So I'm not saying it's a bad thing, but I would say, it is good to take care of yourself at that right moment. When you start noticing hair, start going for supplements, start taking PRP, go for low level laser therapy. I wouldn't say go for topical solutions, because a lot of people, it's not safe to apply minoxidil when you have a kid at home. So I would say meet your doctor first.
So, previously you mentioned Minoxidil and Finasteride, ma'am. How do these medications work?
I would say they're all just supportive treatments. Coming to minoxidil, it's a very popular first line of treatment. So it's basically during the global pandemic, COVID, where doctors were not seeing patients face to face, and it was mostly just video consultations and text and virtuals and all of that. That's when the first line of treatment was minoxidil finasteride combination. I don't think before that there was much of a hype for it, but after this is where the hype for minoxidil finasteride came into play. So they are majorly supportive treatments. They are not the end treatment for hair fall. I would say supplements play a better role. Coming to minoxidil, it's basically a vasodilator. Initially, it was known for blood pressure treatment. So it's actually a treatment for when your blood pressure is high or low. They treat it to calm your nerves or your, say, blood vessels, where it controls your pressure and increases the flow. So it basically plays a major role in something called vasodilation, where your blood vessels are dilated, so the pressure goes down, the flow increases. So how does it play a role in hair fall is when you topically apply it, it increases the blood flow. So people are happy, and when they're happy, they end up stopping it. So when you stop minoxidil, it goes to vasoconstriction. So the blood flow cuts down, and then you lose more hair. So I would say if you're starting minoxidil, be aware of how you're using it. It's very important to make sure you have a proper dosage. You're proper about it. You're not misleading it or overdosing it or misusing it, I would say. So if you're starting it and you want to stop it, it's better to always taper it and stop. So that's how you use minoxidil. Fenestrate, I would say it's something where it can be questionable. So for some people it works, for some people it doesn't work. It's got its pros and cons as well. So some doctors are very happy giving fenestrate because you see instant results. So what exactly is minoxidil? It is a DHT blocker. So like I mentioned, hair loss in men happens because of androgenetic alopecia, majorly their male hormones. So what people believe is that it's your male hormones overplaying. So control your male hormones, your hair gets under control. But a lot of people experience side effects based on it. So it's something very you can question about it. Some people use it, some people don't use it. I like to play safe with organic treatments. It can be your supplements or say with your blood.